going to take a few minutes to discuss the idea of trauma-informed therapy. For starters, I want to make clear that there is no therapy that is trauma-informed unto itself, even if it's a therapy designed to treat trauma. For therapy to be trauma-informed, that has to be an intention that is very consciously set by the therapist. The reason why is because there's a lot about therapy that can mimic trauma. There's intrusive questions, there's a hierarchy of roles, there's a lack of power around time, and it's transactional. It just is. And part of how the therapist needs to work their way out of the therapy running the risk of being traumatizing is by setting some bounds around how they're performing trauma-informed therapy. This includes seeking consent around most questions that one asks, asking which questions feel okay, asking how the client will let the therapist know if things are going too far or feel unmanageable, knowing if there's some sort of time limit towards the end where the client needs the therapist to say we have 10 or 5 minutes left. The difference, for example, between asking a client, where do you feel this in your body? Or would it be okay with you if I asked you where you feel this in your body? Is the profound difference between being trauma-informed or trying to talk about trauma. Trying to talk about trauma is not necessarily a bad thing. The goal of the trauma-informed treatment is to create ways in which it is not a reenactment of the past trauma. And that has to be done with really hard work, boundaries that are set in advance, seeking of consent, and the client feeling extremely empowered to tell the therapist when things have gone too far.